Welcome to the Rare Wellness Podcast. Wellness is a rare treasure hidden in a maze of daily challenges. In this podcast, we will illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 5 minutes or less. I'm your host, Dr. Jamie Lewis, and today we're exploring two peptides that are gaining traction in regenerative medicine, BPC 157 and Pentadeca-Arginate. These remarkable compounds are being investigated for their potential to accelerate healing, reduce inflammation, and support optimal performance. Let's dive into what makes these peptides so unique, how they work, and what the science says about their therapeutic potential. This podcast is brought to you by Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.nwc4rm.com. Before we begin, a quick disclaimer. This podcast is for educational purposes only and not intended as medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. What is BPC 157 and its cousin Pentadeca-Arginate? BPC 157 and PDA share similar properties as synthetic peptides composed of 15 amino acids, designed to mimic natural biological signals that promote tissue repair and regeneration. They're often referred to as healing peptides due to their impressive ability to stimulate the body's natural recovery mechanism. BPC 157 originated from a protein found in gastric juices. It has been showing promise in promoting tissue healing, reducing inflammation, and protecting the GI tract. PDA was an engineered peptide that targets damaged tissue and enhances cellular repair process. These peptides have been studied for their ability to reduce oxidative stress and improve recovery from injury. Together, these peptides are becoming an invaluable tool in addressing both chronic conditions and acute injuries, making them highly relevant for anyone pursuing optimal health and performance. How do these peptides work? BPC 157 and Pentadeca-Arginate share overlapping mechanisms of action, including accelerating healing. These peptides stimulate the production of growth factors such as VEGF, vascular endothelial growth factor, which enhances blood vessel formation and tissue repair. These peptides also reduce inflammation by modulating pro-inflammatory cytokines, creating a more favorable environment for healing. These compounds bind to sites of injury, promoting cellular repair and regeneration, and protect tissue. These peptides are notable for their protective effects on the GI lining and nervous system, and excel at reducing oxidative stress, which can damage tissue over time. Let's talk about applications in regenerative and performance medicine. Here's how BPC 157 and PDA are commonly used in medical practice. Tissue repair. These peptides are used to accelerate the healing of muscles, tendons, ligaments, and joints, and are particularly beneficial for athletes recovering from injuries or surgeries or patients undergoing regenerative medicine procedures. Gut health. These peptides are well known for their ability to protect and repair the GI tract lining, making it a promising option for conditions like inflammatory bowel disease or leaky gut syndrome. Joint and cartilage repair. PDA and BPC 157 are often utilized to manage osteoarthritis and cartilage degeneration. And neurologic support. Early research suggests these peptides may aid in nerve regeneration, offering hope for patients with neurologic injuries. And finally, recovery and performance. By reducing inflammation and oxidative stress, these peptides enhance post-exercise recovery and reduce muscle fatigue and support overall performance. Let's talk about what the science says regarding the use of BPC 157 and Pentadeca-Arginate. Research into BPC 157 and PDA has been promising, although much of it is still in preclinical or early clinical stages. Here are some key findings. With respect to healing and recovery, a 2020 review in Current Pharmaceutical Design highlighted that BPC 157 has the ability to accelerate healing of tendons, ligaments, and soft tissues. A study in cartilage in 2022 demonstrated that these peptides can slow cartilage degeneration and promote joint repair. Their effects on the inflammation has been shown by a study published in Inflammation that showed that BPC 157 reduces pro-inflammatory cytokines and supports faster recovery from injury. With respect to gut protection, Preclinical studies in gut revealed that BPC 157 has the ability to heal gastric ulcers and protect the GI lining. With respect to oxidative stress and mitochondrial health, these peptides have been shown to reduce oxidative damage and improve mitochondrial function in an article published in Free Radical Biology and Medicine. And finally, with respect to nerve health, a study in Brain Research Bulletin demonstrated that BPC 157 may promote nerve regeneration in experimental models, offering potential for conditions like neuropathy. Let's talk about considerations for using these peptides. While BPC 157 and PDA are offering significant promise, it's important to recognize their limitations. These peptides are not approved by the FDA and are often obtained through compounding pharmacies or research suppliers. Their use should always be supervised by a knowledgeable healthcare provider. These peptides are not intended as standalone solutions, but rather tools that work best when combined with a comprehensive lifestyle approach, including proper diet, exercise, sleep, and potentially regenerative medicine interventions. Thank you for joining me on this episode of the Rare Wellness Podcast. If you're intrigued by the potential of BPC 157 and PDA, remember that these compounds represent a cutting-edge approach to healing and performance. While research is still evolving, their applications in regenerative medicine and recovery is hard to ignore. If you found value in today's episode, please subscribe, leave a review, and share this podcast with a friend. Your support helps us to continue to provide the latest in health and wellness. This is Dr. Jamie Lewis reminding you to unlock your body's full potential and live your best life now. See you next time on the Rare Wellness Podcast.